Hi, I'm Toby Newton-John, clinical psychologist at the University of Technology, Sydney. It's an unfortunate truth that in Australia today, chronic illness and chronic diseases are becoming more and more prevalent. When somebody's diagnosed with a chronic disease, the focus tends to be all on the medical side. But the research is very clear that how that individual and their relationship cope with the chronic disease has very significant ramifications for how well they adjust and ultimately how well they cope with their disease in the future. One of the important issues with partners faced with living with a chronic illness is the partner's dilemma about how much to help or not to help the person with the illness in daily activities. And the research tells us it's very important that the partner doesn't help too much and take away some of the independence and the sense of worth that comes from being involved in your daily activities, but not to help too little, and that leaves the patient feeling unsupported. One of the most difficult times for couples dealing with chronic illness is times of increased pain. It's hard enough for the person who's got the pain going through what they're going through, but often the partner feels helpless, as if there's nothing they can do that's of value during those difficult moments. Partners can be enormously supportive and helpful during those times, but they need to ask. It's a conversation couples invariably don't have, but you can encourage your clients to discuss during times of increased pain, what would the patient like their partner to do? Do they want them to be around and available and hold hands perhaps, or would they prefer to be left alone and get on with managing the pain themselves without any distraction or interference? There's a real risk when you're facing an uncertain kind of medical situation of what's called catastrophizing, which is thinking in catastrophic terms about what the future might hold. And remembering your clients and helping them to come back to what they know which is true in the present and not getting carried away by an uncertain and difficult future is going to help them get less distressed and less bothered by the situation that they're in. In the videos of Jack and Liz, we see them referring to what is actually a positive psychology technique called the 3 good things. It helps the couple just to reflect on some of the small things that happen through the day which are still of worth and still of value. And it offsets some of the difficulties and the strains that the couple's going through each day managing the illness, and helps them just to remember and reflect on the fact that despite all that, some good stuff still happens. And it's a really nice, very simple, very easy technique to teach couples to do and share their thoughts with each other as a regular, almost ritual of each day. We hope you find the resources on this website useful, but please remember, they don't replace seeking out professional help.